I'm Simone Olson, co-founder of Amazing Kids. Today's seminar is a free-flowing conversation between practicing clinicians and parents grounded in real questions we hear every day. Our theme today is Autism Debunked. We're here to challenge myths, clarify confusion, and talk honestly about what autism is and what it isn't, so families can make informed decisions with confidence rather than fear. I'm joined by my co-founder, Dr. Jennifer Hensley, a pediatric nurse practitioner with more than 20 years of experience supporting children with autism and leading multidisciplinary diagnostic teams, both in traditional systems and through evidence-based virtual models. Welcome, Dr. Hensley.
Good morning. Good morning, everybody, and thank you for Simone. Before we begin, I just want to thank everybody for being here, showing up today for your child, especially when things feel very uncertain. It takes a lot of courage, so thank you for being here. I also want to just take a minute for us to just stop and take a big breath so we can get our minds in the right space and we can dedicate this next hour to learning and growing together. So if you just join me, we'll all take a big breath. That always feels good, throwing that oxygen up to your brain. So families come into this space carrying a lot of emotions. Some feel relief, finally having answers. Some feel overwhelmed, tired, or unsure of what comes next. And many feel all of these things, and oftentimes it's all at once. And so whatever you're bringing here today, it's all welcome. I want to be very clear about what today is not. This is not about blaming. It's not about fixing your child. It's not about doing everything perfectly. There is no perfect. It's just getting yourself in the right space to be the best coach that you can for your child. It's about understanding how your child's brain works, learning how to support them in ways that actually help, and helping you feel more confident as their parent. Autism is not something that happened to your child. It's the way they experience the world. When we understand that, everything else changes. How we respond, how we teach, and how we connect with them. So for those of you that don't know me, I'm Dr. Jennifer Hensley. I've spent over 20 years caring for children and the last decade walking closely with families of children with autism. And what I have learned is this: people with autism are amazing. Parents don't need more judgment or pressure, and they just need clarity, compassion, and a team. So today is about teamwork. And what's our mission, Simone? Empowering parents with teamwork, right?
Absolutely.
So about teamwork for you and your child, for you and your child's providers, and let's not forget for you and yourself. So as we go through this seminar, you don't need to take notes. You don't need to remember everything. If something resonates, notice it, take it with you. If something doesn't, just let it go. I want you to hear this also before I go any further. Your child is already enough. People with autism are amazing. Skills can be taught to them, understanding can grow, and you are not alone in this. And if you're a person with autism joining us today, welcome. You have an amazing brain. So I recently moved to Florida and I love wildlife. And I'll tell you, I've had some pretty amazing kids know all the details about wildlife. And I was hoping to show a little video today, but I am not skilled enough to share it and not mess up everything else on my screen. So Simone and I have had a crash course of trying to learn how to do all this social media, right, Simone?
Yes, it's like drinking from a fire hydrant.
Absolutely. For two people that don't love social media in the first place and being on video. But I had this amazing view today of the wildlife where a flock of white pelicans migrated down here to Florida and they're all congregating together. And I believe it or not, where everybody is, I know you're cold. We're actually a little cold here in Florida. We're in the 30s. And these pelicans were all just hustled together and they were feeding and they just were moving in unison. And it was beautiful. And I really wanted to show the video too, but I'm not going to be skilled enough today, maybe next week after I practiced a little bit. But this is what the Playbook seminar is about. Like, how do you build that team for your child? And you have to get the right players in the field on the position that is going to help the team at the right time. And so let's start by talking about autistic brains and how they process the world and what matters most in their everyday life. So Simone, I'll pass it over to you.
Great. So our first question today is, what is autism today? Let's start at the beginning. Autism is a word that gets used a lot, but not always accurately. Can you talk about the nature of autism today, including where Asperger's fits in now? What is the current definition of autism? And for families who are considering an evaluation, can you also clarify what a true medical evaluation is versus what's simply a test? What does a medical evaluation include? What does it typically cost? And why might a family choose a test instead of a full medical evaluation? And this question has a lot of different parts, so we might need to just take it, part by part. We can circle back.
Absolutely. I was just going to say that too. That's a lot. That's a lot to uncover in our first couple minutes, but it's so exciting and it's so true. So what is autism today? So where to begin with this question? So I think I'll start with the second part. So, what is a true medical evaluation versus simply a test? I think last week, so this is week 3 or 4 of our seminar, and I think last week somebody asked, "Is there just a quick autism test that I can do online to know if my child has autism or if I have autism?" And so, autism is a very, very complicated neurodevelopmental disorder. So I have next to me the Diagnostic and Statistic Manual of Mental Disorders, and this is the 5th edition. So this is known as the DSM-5. So if you have a child that's gotten diagnosed with autism, or you're seeking an evaluation, or you're a healthcare provider, or you're a colleague that takes care of kids with autism, this is a really thick book. This has got a lot of diagnosis in here, but autism is one of the many diagnoses in here. And it's kind of like a little bit of a roadmap that we utilize clinically as we're evaluating the child to determine if they meet the criteria of autism spectrum disorder. Now, autism spectrum disorder comes with many other diagnoses, and it's very common to have autism spectrum disorder with any number of other genetic disorders. And so it can be a very complicated diagnostic evaluation. So, in my mind, a true medical evaluation involves developmental testing, which would be testing that parents complete in the convenience of their own home, oftentimes, questionnaires, standardized, well known, evidence based questionnaires to assess to see, do we meet clinical criteria of autism? After those questionnaires are complete, the healthcare team evaluating the child or provider should have the ample time to review those questionnaires and then spend a period of time with the child. And this can vary anywhere from typically 60 to 120 minutes. And that time is critical because we're going to be observing that child. How are they interacting with their family, with each other, with siblings, with healthcare teams? Are they advocating for themselves? So that clinical evaluation really is the kind of the nuts and bolts of the diagnosis. So we take all of that developmental testing and we add to it all of the clinical evaluations and input. And with that, we come to the consensus, do they or do they not meet the criteria? And so the evaluation, a lot of places will split this process up into 2 to 3 visits. Here at Amazing Kids, I feel it's very important. We do not need to delay these evaluations. So our mission, another second mission, is to get kids evaluated within 72 hours. So as long as parents can fill out that paperwork and get in for the appointment, and again, everything is virtual, so it's in the comfort of the child's own home. So as a parent, I would recommend definitely seek all the testing and the time allotted to really spend the time with your child. Some institutions prefer to use a team-based approach. So you might have a speech pathologist, an occupational therapist, a psychologist on the team. So they're evaluating the child as well for communication disorders, sensory processing disorders. So a team-based approach is appropriate, but it's not necessary for the evaluation. And so the medical evaluation typically costs somewhere between $2,000 to $5,000. And so unfortunately, there's very few providers across the country that do these evaluations. And so with insurance, these services really are bottlenecked. So it's not unusual for people to wait 1 to 2 years for the evaluation. Here at Amazing Kids, we streamline that process because we are not taking insurance, because we need to get these kids evaluated, diagnosed, and treated. Because every bit of research tells us the earlier we get you diagnosed, the earlier we can get the services started. And I have seen many, many kids overcome a lot of the clinical characteristics of autism. You never outgrow it, but with this intensive intervention and the right players on the field at the right time, kids can really be set up for success.
That's great. Thank you for all that information. And so let's go circle back to the beginning part of the question. I think that the definition of autism has changed a lot throughout the years. And I think many people, when they think of autism, they also think of Asperger's. So, where does that fit now in the current definition of autism?
Thanks for that question as well. So, as of 2013, again, our DSM-5 gives us the diagnostic criteria. As of 2013, and it's still hard for people to hear, and we're in 2026, Asperger's disorder does not exist anymore. We don't have any coding or any ability to diagnose Asperger's disorder. Asperger's disorder, oftentimes people who had the diagnosis prior to the coding and the diagnostic criteria changing, they oftentimes, most of the time, do meet criteria for autism spectrum disorder, but there should be a reevaluation to ensure that. So the only diagnosis we have now is autism spectrum disorder. So there's no more Asperger's disorder. There's no more PDD is another one, pervasive development disorder. That's also gone. There's no more infantile autism, and there's no more high functioning and low functioning. And I will tell you, it's really upsetting to hear high functioning and low functioning. I think that unfortunately that's been ingrained in every medical professional's mind, every parent's mind. Simone, have you heard of that? We actually haven't even talked about that yet.
Yes, actually, I was just thinking the other day, I was in a conversation with some people and both Asperger's and high functioning came up. So it's interesting that that is definitely something I think that prevails around the country, probably.
Yeah, so what is high functioning and low functioning? Like I could put any kind of words or labels or anything in there, right? So we don't have that. We don't use that as formal diagnosis. What we do use is autism spectrum disorder severity level 1, severity level 2, or severity level 3. So severity level 1 is the lowest level, and these are kind of subjective measures from the healthcare provider that's diagnosing the child, and they change. So, autism again is a diagnosis of social delays and rigid behaviors. So, when I'm socially struggling more, I'm probably going to be a higher number, right? So, when a child can be cruising along and they hit kindergarten, and there's a lot expected of a kindergartner. So, we might be a level 1, but we might jump up to a level 2 because I'm socially really overwhelmed. I might have a lot more rigid behaviors. My world might be crashing down on me because the fire alarm, teachers have high expectations. And so, I might go to a level 2, and then school settles down. I might go back down to level 1. So I don't like my parents to get hung up on the severity level 1, 2, or 3. The goal is hopefully that we get your child down to a level 1 and that they, of course, have autism, but they're thriving with their autism and they're integrating into the world, and the autism is not limiting them. And so, with the diagnosis, there should be a severity level 1, 2, or 3. The other thing that defines autism, which is not autism, but other secondary disorders, right? So, we might have a communication disorder. And if someone can't communicate verbally, we have to give them tools to communicate. And that can also define how they are functioning or their cognitive abilities, what their intellectual ability is. So I always recommend we get some kind of a cognitive assessment. The earliest we can do cognitive testing is somewhere between 5 and 7, and that's where is someone's intellectual ability. Now, I caveat that with kids with autism don't socially interact well. And so I would be a little bit hesitant to do that assessment until the child is really understanding the social interactions properly, because it's not unusual. I've heard this so many times where parents say, well, my child's in school and they've got them diagnosed with an intellectual disability and they're in special needs classes. And I'm like, yeah, but your child knows how to take apart a computer and put it back together. So this isn't matching up very well. But the world has a hard time seeing what they're capable of. So that's those secondary diagnoses. If those are not addressed, those can definitely define somebody with autism, and they really should not. We have to address each one of those secondary diagnoses as well.
Thanks for that. It's really interesting to hear you say the three different levels, because I think a lot of times people feel like if you have a diagnosis of autism, you're sort of set in a box. And so it's fascinating to hear that depending on what's going on with the child or even an adult, what's going on in their life and what they're faced with new, that they could move between the different stages as well. It's not always a permanent number, let's say.
Yeah, thank you for highlighting that again. So I do want the audience to take that away. Like, an autism spectrum disorder level 3 does not mean that your child is never going to be independent. So it just means they might need some more tools for their toolbox. So thanks for bringing that and highlighting that back again, Simone.
It's a good use of the word spectrum, right? That they people move back and forth on the spectrum. Which actually helps segue us into our next question. What does success really look like for these children and adults? One of the biggest fears parents carry is about the future. When a child is diagnosed with autism, many families quietly wonder, what will my child's life look like? Can people with autism drive? Can they work? Can they move across the country, build relationships, or start families? When we talk about success for individuals with autism, what does success actually look like?
I don't have any limits on my patients, and I am hopeful that we will one day be in a world where nobody has any limits on people with autism. I mean, frankly, they're smarter than all of us put together. And so, what does their child's life look like? It should look like any other child's life. There should be no ceilings on them. They should absolutely be able to drive. They should be able to get jobs. They should be able to move wherever they want to. They should be able to internationally travel, whatever they want, build relationships, get married, have kids. They're amazing. And so I don't want any caps on my patients, and I don't want any caps on anybody with autism. There's a gentleman out of the UK that is an amazing artist, and I can't remember his name off the top of my head, but he draws cityscapes. And so he'll get in a helicopter and he'll fly across a city one time, and he draws the most beautiful cityscapes that you've ever seen, just in one flight over one city. You can be very famous, and I'm sorry, I'm drawing a blank. But he's brilliant and he's world known. And so, why would I put any limits on anybody with autism? There's so many famous people out there that have autism. So, the goal is going to be independence. And how do we get there? How do we get there, Simone?
By building a team.
That's right. We're building a team, right? One player at a time, we're going to build that team. And so, I'm giving you guys a lot of information. And so the other thing that I just want to share is that you're not going to build this team overnight. This team is going to take time. It's overwhelming as a parent oftentimes getting the diagnosis, learning how to just go through the grieving process of wow, this is hard. This is heavy, right? And we got to get to that grieving process of like anger and denial and oh my gosh, eventually we get to acceptance, right? And we realize, okay, I have the same kid as before the diagnosis, and this child is amazing. And so I have to give him the tools as his parent to help him figure out how to integrate into the world, right? Because we want him to nail the interview. We want him to be able to go to the college of his choice. We want him to be able to get married and have kids and have a very fruitful and successful life, whatever success is for that child. And so I don't want to put any caps on him. I've heard too many times, oh, he has autism or she has autism. So we're just going to let them do that repetitive behavior and not teach them and give them the tools to set up for success. Like, what is that? So I have to empower families because I think the world doesn't understand people with autism. And so I've heard too many healthcare providers. I don't know how to examine them. I don't know how to do this. Well, we have to give you the tools. So not only is our mission here at Amazing Kids to get kids diagnosed, our mission is really to educate and empower colleagues, healthcare providers across the country on how to take care of these kids. They're so amazing. We just need to give them the tools. We need to give the healthcare providers the tools. And so that they can make sure that they are actually an active part of the child's team. So we have to build that team. It's absolutely critical. If we build the team, and the team is going to change again. So I might have speech therapy on first base for the first 5 years of my child's life. And then all of a sudden, my child is talking and reading chapter books, which happens. I've had patients go from not talking to reading chapter books at age 5. And parents were like, what? And the 5-year-old read the third grade sister's chapter book. So we just have to tap into them and give them the tools. And once they have the team, and we have to adjust the team. So that speech therapist was really important those first 5 years, but all of a sudden they don't need to be as important. So we can put them on the bench for a little bit. And maybe we need to move in counseling or we need to move in audiology because we're concerned about hearing or something else. So the team has got to change. And there's lots of people out there ready to be on the team. Thanks for that question.
Well, and I just honestly, I just love hearing you talk about autism and the amazing kids that do have autism. I think that what you've said about, there's this fear factor that people are just like, oh, we can't change anything. They are what they are. And listening to you, you were one of the first people that I've ever really just have an abundance of optimism about how children can be independent. All children can be independent, and then that's the goal. In fact, I feel like you have a couple of stories of children who you have treated over the years, and some have even gone to college and are now living as an independent sort of adults. Correct? Isn't that definitely, I mean, that's such a success. Like,
Absolutely.
I think it's just so exciting to hear that.
Why would I ever put a limit on your child? It's not something that we should do. It's not something we should allow the world to do. And unfortunately, if we allow the world to do that, your child's going to accept that and they may not thrive and they may not flourish. And so it can definitely become a risk.
Well, that actually leads us into our third question about when does a safe place become a risk? This is a question we hear often and one that many parents struggle with. Children with autism need safety, predictability, and respect for their preferences. At the same time, they also need preparation for the real world. At what point does a safe place become a dangerous place for a child with autism? How do families balance honoring the child's needs while still preparing them for independence, discomfort, and growth?
Yeah, so I think this kind of circles back around, Simone, to even how we opened up. A child with autism is not any different than any other child. Safety is the number one concern for every parent. Doesn't matter who you are, who your child is, diagnosis, no diagnosis, your child has to be safe. And so oftentimes everyday environments can be safe for a period of time until there's some extra external force that can make that a very unsafe place for your child. For example, it's not unusual for children for autism to have hypersensory behaviors. So the sound of the fire alarm in school could send them into a complete panic. So that safe place of school where they go to every day all of a sudden becomes a very unsafe place for them. And so that's where it's important. And you, as the parent, need to really advocate. Say, I know my child struggles with loud noises. We need to have the right team in place so that we can make sure my child is successful in that school environment instead of, and this is the other risk, instead of taking them home and homeschooling them and putting them in a bubble and not exposing them because it's too hard for them, right? So there's different risks I think we can talk about. We need them out integrating into the world as a 5, 6, 7 year old instead of reclused at home and restricted because then they're not going to get used to the world. And so there's certain things a 5 year old needs to be exposed to, which are different than a 7 and a 10 and a 12. And so this is a fine line for parents. So I will challenge parents to follow your instinct. Parents have really good intuition. So even if this diagnosis is brand new for you and you just have know nothing about autism, I challenge you to just follow your instincts. You know when something's not right, and you know when you need to become a mama bear or papa bear and protect your child a little bit more, whether they have autism or not, right? So don't neglect your own instinct, but we do need to challenge them at the same time. And so, not that, again, homeschooling can be amazing and it can be the perfect place for your child, but they absolutely need socialization. So it's hard to socialize your child, I'm sorry, your child, if they're not being exposed to other kids and other people their age. And again, those peers are going to be the most challenging for your kids. They always are. Peers want give and take. So kids of the same age want give and take. You share this toy, I'll share this toy. You go here, you can lead first, I'll lead next time. And peers are going to check out. If your kid is not interpreting the social environment well, and not allowing their classmates to go first or take turns, then that classmate's going to just check out on them. But we still need to expose them. They have to learn this, and they're capable of learning. We just need to, again, give them those tools. So the dangerous place, again, in this world could be that, again, safe environment that gets so overwhelming because of some external stimulus, or there's many, many examples out there. Or the second dangerous place I would say is that if we just confine them so much and we restrict them because we're afraid of them interacting with the world and they're afraid to interact with the world, then how are we ever going to have an independent child? So the big thing that I always say to my parents, and if one of my parents is on, you've probably heard this from me. So say your child's 10, right? And every time I see these kids, I'm going, what's next? Like, how are we going to get you to that next level? You're 10. I need you functioning as a 10-year-old. So I'll say to the parents, your child has 8 years, right? 8 years till you're an adult. Well, actually at 10, I would say, how many years do you have till you're an adult, right? And again, do they know 18 is legally an adult? And so 8 years, that's it. And we're 14, we have 4 years. We're 16, we have 2 years, because the goal again needs to be independence for these kiddos. And so oftentimes I see that there are things that are very easy for people with autism, whereas there's lots of things that can be also very challenging. So parents just have to balance this out. If the child is very gifted at mathematics, well, we're not going to put so much effort in that, especially if the child's doing square roots at age 4. We're going to put the effort towards engaging them with the appropriate social environment and peers. So we all only have so much time in a day, and that's again where that team is very, very important. So thank you for that question.
Thank you. I think that we're actually at the Q&A section of the seminar. Would you have any like final thoughts before we move on to Q&A, or would you like to just move on to Q&A?
Yeah, let's open it up. I'd like to hear from some of our families today. And also, if you feel that this is helpful, please share this seminar link with anybody. We are looking to educate and empower families. And so you don't have to be a family. You could be a teacher, you could be a therapist, you could be someone who just is passionate about people with autism. So definitely open it up and invite your friends and family as well. So, do we have any questions?
Like there is a question.
So,
Okay.
how does a parent know when they're doing enough? And how do we get started building the team that you mentioned? Again, another great question. I think parents never feel like it's enough. I'll tell you, I have 3 adult kids and I still find myself going, oh, I should have done that or should have done this, right? So it's just never, ever enough as a parent. We always feel like we're falling short. I think we need to give ourselves a little bit of mercy. So I think that building that team is critical. The hope is that the child takes over the team one day. And so the sooner the parent builds the team and includes the child. So I'm a huge advocate of kids going to their IEP meetings at school, their individual education plan meetings. I'm a huge advocate of kids. I always challenge my patients. So what are your goals at therapy? And they'll come in and say, oh, I would just come from therapy. We did this and we did this and we did this, and it was so much fun. Okay, well, what are your goals? What do you mean? What are your goals? What are you working towards? And they don't know. So I'm sure the therapist educated them on what the goals are. I would like to think so. We're actually going to have an amazing therapy team on probably in March or April. So look for an amazing speech therapy team, an occupational therapy team coming on and dialoguing with us. But we have to know those goals, right? And so every time we meet goals, we're going to add a new set of goals and a new set of goals. And so that kid should know what the goals are. ABA is a big one. ABA works on a lot of behaviors. And it's all play therapy. So that's the other thing it's really important for you as a parent to know, is that all therapy is based on play for kids, right? Because that's what they're supposed to do, is play. Wouldn't it be nice if adult therapy was all based on play, right?
I'd sign up.
I sign up right away. Let's play. But the kids don't ever know their goals. And so they should know their goals. And so once the kid is taking over the team and they can come in and tell me, hey, Dr. Hensley, my goals are this, this, and this, and I met my goals, guess what happens? They get so motivated, because kids, we're all driven by rewards, right? And they use like sticker charts and all this stuff, but the kids don't quite realize why they're doing what they're doing. And so once they know their goals, they get very competitive and they want to meet those goals and they start taking over the team. So just as every other child, the hope is that the parent is building the team and the child takes over the team. So the other thing I want to add is when the child has started to take over the team, they may come back and say, I don't want to go to this therapy anymore. And so the parents are like, but you still need therapy. Well, I don't want to go. Well, then they come in to see me. Well, why don't you want to go? I don't like them. Well, why don't you like them? Because it's not fun or whatever, right? Or they might say, I've met my goals and they're not giving me anything new. Well, gosh, that second child, you know what? Maybe it is time to stop therapy, right? They need to advocate, right? Who wants to be in therapy forever? Just think of the word therapy. It's all meant to be short term. We over therapize these kids, right? So sometimes they're in ABA 40 hours a week, and speech and OT an hour a week, and sometimes PT, and then maybe counseling or social skills groups. And they don't even have time to just be a kid and hang out with their family. So it's very, very important to be listening to the child. So I know that was a long answer to your question, but it's important for us to, again, adjust the team as we go. So that ABA therapy should not be 40 hours a week once we're school age. It really needs to drop down, and that kid needs to be in the community. So My ultimate goal for your kiddos is that they transition out of therapy and into the community as soon as possible. Maybe it's adaptive sports, maybe it's Special Olympics, maybe it's in the band, maybe it's in the advanced band. I don't know, whatever they're capable of doing. My goal is to get them transitioned out of therapy and into life so that they can enjoy being a kid and not be overwhelmed and inundated by therapy. But again, we have to do that judiciously when the time is right.
Such a great answer.
Yeah.
Great question, too.
So it looks like we have a second question. Simone, are you able to see him now?
I, nope, I can't see it.
Okay. So this is the first time I have heard that I need to build a team. Can you share with where this idea comes from? At what point does a child take over their own team? So I think we addressed that a little bit, but really with any chronic medical diagnosis, you naturally do this anyway, right? So say, I mean, there's just so many diagnoses out there, but we'll just use a diagnosis like Down syndrome. Down syndrome has a lot of very known secondary diagnosis that can come along with it. So, when you have Down syndrome, you typically need an endocrinologist to manage the thyroid, you need a cardiologist to manage the heart conditions, and then you need therapy and you need special school supports. And so, people are more comfortable with Down syndrome than they are with autism oftentimes, but it's very similar. We have to build a team. And as you're building the team, what are some good traits of a good coach? Simone, anything you can think of, or anybody want to throw anything out there in the chat?
Someone who's positive but challenging at the same time.
Excellent. Anybody else have anything in the chat? What would you want in your coach? Maybe it's, you're going to be a future Olympian or you're going to be on the local soccer team. And, what would anybody else want from a coach? Feel free to throw it into the chat box.
I think someone who sets realistic goals that are challenging but not overwhelming.
Absolutely. And a coach needs to know their teammate. Motivating. I love it.
Someone says motivating.
A coach needs to know their team. And so some players we can motivate a certain way, and some players we better not motivate them that way or they're going to have a meltdown, right? So the coach needs to know the team and the coach needs to care, right? So, as a parent building this team, get to know those teammates. Like, get to know your child's teacher, get to know the child's therapist, right? Like, hey, how was your day? What's going on with you? Advocate, empower these people, but also buy into them because they're spending a lot of time with your child. And if you care about them, genuinely care about them, they're going to care about you and your child, and they're going to become an active member of the team. Everybody in healthcare is very strapped for time. I mean, I can't go to any healthcare provider and hear from them. I have all the time in the world to take care of my patients the way I want to. We come into healthcare going, I want to care for people. I want to take care of people. I want to make this world a better place by caring for people. And then we get into healthcare and we get exhausted because we are constrained by insurance and we are constrained by colleagues and we're constrained by time and money and revenue. And we lose sight of why we came into healthcare in the first place. And then on the receiving end, you as families feel like, oh, that healthcare provider didn't look at me. They didn't shake my hand. They didn't talk to me. They didn't even introduce me to them. They just came in and started like touching me. Well, we've lost that bedside manner and we've lost what's important, and that's you. That's you as the patient. And so you have to build that team, and you are the coach. So if you're not someone who is dynamic and a patient advocate and, an extrovert, you got to figure it out. You got to build that team. And maybe it's about finding the right assistant coaches to help where you feel like you're a little deficient, that they can kind of help you build that team. But coaching the team is the most important job. And once again, once you find the right team and put that team in place, the hope is that the child is then going to take over the team. Good question.
And I imagine the team is continually changing too and updating as the child grows and the needs change. So it's a work in progress also. It's not necessarily just like we all are. We're all works in progress. It's not
Absolutely.
stagnant and you don't want to stay stagnant. It's got to keep changing.
Absolutely. That team should be ever changing. And you might think you have the best team, and the kid starts advancing so quickly that in 3 months we got to change that team. And that's hard because it's hard to get the right players on the field. So I think the other thing just to think about too is your team should always consist of other parents and other people involved. So join those Facebook groups. I know there's a lot of misinformation out there, but join those groups, network with other families, learn what their successes are and what their struggles have been. And that will help you also to build that right team and to stay ahead of things for your child, to preempt, okay, well, my child's only 3 right now. What's it going to look like when they're 10? What's it going to look like when they're 15? And again, just kind of staying ahead of it and adjusting the team. So eventually, the goal is that we don't really need a team. The child's just being a kid and they're going to school and they're learning and they're making friends and they're on sports teams or in clubs and they're just living their life and doing the things that a typical child would do. That needs to be the goal for every child with autism is to help them function at the top of their ability without any ceilings.
That's almost a great note to end on if we don't have any further questions. There's a question. What does success look like for a parent? How do I know when I'm advocating for my child really well? What should I be tracking weekly or monthly?
I think that's another good, definitely layered question. And so, what does success look like for a parent? I can't define that. You can define that for yourself as a parent. I would say we need to give those child goals to be as independent as possible. Me as a parent, I have always expected my kids to be very independent. I've been very open and honest with them. And I think that it's important to do that for all parents. I think all parents need to be open and honest. And so, that advocation for your child should be something that, your child's meeting those marks. They're assimilating, right? And so it might be something that your child is an amazing artist and your child puts their art into some kind of art show and they, win a prize or they get recognized for their work. And that you'll see that sense of fulfillment and accomplishment in your child. So I can't really tell you what success looks like as a parent or what success looks like for your child's team. That's something that you really have to define yourself. And really, ultimately, the coach needs to be the child. And so I just kind of want to touch base. This isn't something that we've actually talked about in any of the seminars yet, but I do want to bring it up. I feel it's very important for us to be very honest with our kids about their diagnosis. So I hear this from parents a lot. Should I tell them? Should I not tell them? Or every once in a while, I'll get a parent say, just don't mention the word autism during the visit. And I'm like, don't mention it at all? Like, we're here to talk about the autism. But I am just very transparent with my kids, with my patients. I always have been. And if they know they have autism, they can educate themselves and empower themselves and really overcome a lot of it. And you can't do that as a parent. They have to be the ones to do that. And if they don't ever know they have autism, they just know, I don't have friends. I don't get along with people well. Something's not right with me. We're going to kind of send them down a challenging road of mental health because it doesn't feel good to not be ever able to assimilate. And so I think it's important to be very transparent with them, but the goal really is to give your child their team. Let them take over that team, let them run the show. And a good age to really start thinking that they should be running the entire show is really about age 14. So definitely 7, 8, 9, 10, they should have a good amount of input. But by the time they're 14, if they're not really running the show, it's time to start talking about guardianship and what that's going to look like, which is a hard discussion to have, but it takes a while to understand guardianship and trust and making sure your child is set up for success as an adult if by 14 they're really not running the team. So I think that can be a good gauge for most parents, and every situation is very different. But the team's success is really going to be dependent on what you and your child have as goals for your child.
Thank you for that. There's another question in the chat. What online resources would you recommend for someone who wants to do additional research on autism? It seems a lot of sites can lead you down a rabbit hole of oftentimes inaccurate information regarding this complex diagnosis.
That's a great
Good
question.
question.
Yeah, I get that question a lot. So I just want to preface this with I'm not an autism researcher, and there are a lot of amazing studies out there. I think the biggest question most people have is, well, what causes autism? And so the sites that I would always recommend would be the American Academy of Pediatrics, the World Health Organization, and then there's a lot of just like autism centers like CHOP and UCLA that are doing a lot of research. So since autism is so multifaceted. We really feel at this point we have about, again, I caveat this with I'm not an autism researcher. There are people that are dedicating their careers to doing autism research, and I'm dedicating my career to diagnostics and caring for people with autism. But I do try to stay as up to date as possible. And so it's multi-layered. So we do have about 1,000 genes associated with autism spectrum disorder at this time. And there's just changes in neurobiology, there's changes in the environment that, I know things came out, our government officials talked about medication exposure. There's just so many layers and factors that I definitely do recommend that you educate yourself on it and find those good, healthy sites. Spark is a really good site to go to, and that's the Simon Foundation. And then the International Society for Autism Research is also another site if you're really interested in the scientific research that's going on. We do know that there are definitely at-risk populations. Again, I think people with autism are amazing, so I don't ever recommend people try to not have autism because their brains are just wired different. Again, they're not broken, they're just wired different. But I do recommend that, parents educate themselves. So some of the higher risk groups would be women with advanced maternal age getting pregnant, and then also women that have diabetes during pregnancy. Premature infants are also at higher risk for autism. So, again, we still have a lot to learn about the genetics and the causes of autism, but I do think that that's critical. And I think this can be very overwhelming for families trying to dig into the science, especially when you're getting a new diagnosis. And there will probably be a lot of family members say, no, the child doesn't have autism, or people that interact with your child. And so it can feel very overwhelming, feeling like I have to learn everything today. So again, finding those reputable resources. I also just want to add, there's unfortunately so many people out there that want to prey on people with autism and families, claiming that we can change diet and we can not vaccinate our children because that's what caused the autism. There's been well over 16 well-documented studies to prove that autism is not caused by vaccines. And so there's a risk to not vaccinating. Again, every parent is making the best decision that they can for their child. And I stand by every parent's decision because it's your child. We are here to support you. Again, you want to build the right team for your child. And if teammates aren't doing their job and they're causing more stress for you as a parent, they need to go on the bench. So definitely looking at those websites. There's also a lot of good nonprofit sites, such as Autism Society, Autism Foundation for Research has a lot of good resources as well. I really like the Porchlight Learning series. That's a free educational series for parents. But again, just trying to sift through all of that can be challenging. So if you have a trusted healthcare professional as your primary care provider for your child, that really can be a good resource for you to say, hey, I saw this, or I was thinking of doing this. I was thinking of having my child do a gluten-free diet. Seems like most families with kids with autism like to try gluten-free diets at some point. I'll tell you, I've been in healthcare a long time. I've had maybe 2 kids really and truly have celiac disease. And gluten-free diet can definitely cause you to be deficient in other minerals and nutrients that if you're not having any gluten, you could be deficient. So I would say build a team around that. If you really want to try that, talk to your primary care provider, go to a nutritionist, say, what does this look like if we try it? And what can we do to make sure that my child doesn't get deficient in other nutrients? But building that team is very important. And again, educating yourself. So thank you for bringing that up because you want to empower yourself with as much healthy education and research as you can.
Thank you for that. Another good question. How can schools best support autistic students and their families to promote success in the school environment?
I think that's another great question. We really haven't talked about education too much. And so I think the first thing is just education. Education that this is a diagnosis that has a lot of variability, and we need to have we need to have educated staff that understand autism and understand how they can best support each individual child. So getting to know the child and getting to know the child's needs really is about building that team with that parent. So partnering with parents is very important for educators, and that's how we promote success in the school environment. I mean, once kids start school, they're almost at school more than they are anywhere else. And so for kids to be in school for a full school day in a safe environment is the parent's number one priority. And then the second priority is my child getting educated? Unfortunately, sometimes behaviors can be so challenging in the school environment that children with autism really get left behind because they're not being challenged educationally. Because if they do get challenged, they have meltdowns and very challenging behaviors. So every child's plan needs to be very individualized. And when that IEP is developed, so IEP is an individual education plan, which is very specific for each child, it really needs to be enforced. The parents are a part of that IEP team, the healthcare team should have some input, the school personnel has a lot of input. How do we build a safe and nurturing environment for that child where they can learn and they can grow and they can develop and they can make friends and they can have a very fruitful academic experience? We're only in school a short period of our life in that formal instruction. And when behaviors are so challenging and we're not managing those behaviors well, then they really lose such valuable socialization and growth and development. And so having that partnership with the parents and the child, letting the child learn to advocate for themselves, and of course, putting that child in the highest level environment that they are intellectually capable of. So it's not unusual for kids with autism. They might be brilliant, but they're in special education. And so if I were really smart and had a very high IQ, but I was in special education, that's going to basically exponentially aggravate my behaviors because maybe I'm in second grade and I have the brain of a fifth grader, but I'm doing kindergarten work. And it feels very disharmonious and very overwhelming because now I'm put into this environment with people that have a lower intellectual ability than me. And I'm having meltdowns like a 2 year old, even though I have a 5 year old brain. So this is challenging for schools to manage kiddos and educate them to the top of their ability. So partnership is absolutely critical. Again, educators don't have a lot of time. So who is this going to fall on? The parent, right?
Parents.
The parent. It's parents have to be actively engaged and partnering with the school professionals. Good
Thank
question.
you. Great question. I think we have time for maybe one more question, if there is one. If not, Dr. Hensley, do you have any final thoughts?
Yeah, I do. So, again, I want to just thank everybody for coming today. So, as we come to the end of our time together, I just want to acknowledge all the effort it takes to sit with all this like new information and to really just be thankful again. Thankful and take this time to reflect on your child in deeper ways. So, today was about learning. Everything or having all the answers is not essential. Like you're not going to have all the answers. It's about understanding your child, understanding that you don't have to walk this journey alone. Your child, I've said this so many times to families, your child is the same child that you walked into my office with that you're leaving with today, even though now they have a formal diagnosis. So, same thing, you have the same child before you walked into this seminar that you're walking out with today. And what's changed is not who they are, but what you know about them, right? So the tools that we discussed today are not about perfection. Again, I'm not trying to change your child. I'm trying to help you connect with them, support them, and progress one step and one day at a time sometimes. It's okay to say, like, I can handle this minute, or I can handle this hour, or I can handle this day. I'm not going to fix and solve everything today. And as parents, we're just naturally problem solvers. There'll be days that feel really hard, and then there'll days you'll feel really hopeful. Both can even exist even at the exact same time. So as you leave today, I want to thank you for allowing us to be a part of your child's team. It's a privilege. If you like what you've heard today, please tell your friends about us. Tell other people about us. We're here to provide a very safe and loving and nurturing environment for you and to walk side by side with you. I think it's been the absolute best privilege to me to be able to walk hand in hand with my patients and my families. And when your child has successes, like that warms my heart. And when they have failures, that hurts my heart. We're here for you to make sure that you know that you're not alone. And I want you to find team members to put on your child's field that have that same passion about you and your child as we do today. So I want you to take with you today what felt helpful and useful and leave behind what feels heavy and overwhelming. And most importantly, remember this, like your child has inherent worth. Growth is possible and you are not alone. Thank you for trusting us in this space today. and for the love and advocacy that you show your child every day, and go build the best team that you can for your child. Thank you for joining us.
Thank you, Dr. Hensley. Thank you, everyone. Your questions, your participation just made the session so warm and inviting. At Amazing Kids, we believe people with autism are truly amazing. We help families gain clarity sooner through evidence-based evaluations and thoughtful modern diagnostic approaches. If today's conversation was helpful, we invite you to explore the Autism Playbook by Dr. Jennifer Hensley, a practical guide to understanding diagnosis, building the right supports, and planning with confidence. And to every parent listening, you are not behind, you are not failing your child, and you are allowed to ask the hard questions. Understanding autism clearly is one of the most powerful steps you can take. Thank you for being part of Amazing Kids.